Back then, seeing someone wearing a hat, a mask suggestive of a bird beak, goggles or glasses, and a long gown would identify as a plague doctor. The gowns were made from heavy fabric or leather and usually waxed. The beak contained herbs and perfumes. They thought at that time it would purify the air and it was helpful in relieving the stench. They would also carry a pointer or rod to keep a distance from the infected.
When Yersinia pestis is inhaled, it can lodge in the lungs and result in a disease known as the pneumonic plague. It can spread from person to person when the infected person coughs or sneezes. It enters the body by being inhaled. It could be spread intentionally if the bacteria are put into an aerosol form. Lung-based plague is the most virulent and least common form of plague. Pneumonic form is caused by spread to the lungs from advanced bubonic plague. Secondary pneumonic plague may form aerosolized infected droplets, transmit plague via droplets to others. Untreated pneumonic plague has a very high case fatality ratio, a death rate of 50%. Distribution of the plague coincides with the geographical distribution of the rodents it affects, found in all continents except Australia within the broad belt in the tropical, subtropical, and warmer temperature climates. Diagnosis and confirmation of plague requires laboratory testing. Best way to confirm is to identify white pestis in a sample of fluid from the bubble or blood or sputum. White pestis can be isolated from bubble aspirates, blood cultures, or sputum culture if pneumonic. To check for pneumonic plague, fluid will be extracted from your airways by a tube that is inserted down your nose or mouth and down the throat to the lungs. This test is called endoscopy. Plague can lead to gangrene if blood vessels in your fingers and toes disrupt blood flow and cause death to tissue. In rare cases, plague can cause meningitis, an inflammation of the membrane that surrounds your spinal cord and brain. The signs and symptoms of the pneumonic plague happen 1 or 4 days after the exposure to the bacteria of white pestis. The signs and symptoms are fever, headache, weakness, bloody or watery cough due to infection of lungs, and rapidly becomes worse and can be fatal. Rapidly developing pneumonia with shortness of breath, chest pain, cough, bloody or watery mucus, and may cause respiratory failure and shock.
The pneumonic plague is a lung-based plague. It is least common and it is an advanced form of bubonic plague. The fatality ratio is from 30 to 60% that were left untreated. It is known as the Black Death. In the 14th century, it caused 15 million of deaths. It has occurred in Africa, Asia, and South America. From 1998 through 2009, 24,000 cases have been reported. In 2013, 783 cases were reported and 126 deaths. The days in incubation are 1 through 6. The plague scattered in rural areas like northern New Mexico, northern Arizona, southern Colorado, California, southern Oregon, and far west Nevada. The mortality rate is from 90 to 100%. It progresses within 2 to 4 days. Some even died within 36 hours of the plague, if not treated. The plague has had 7 outbreaks, 2,000 deaths in Africa, Asia, America, and Eastern Europe. 98% of the plague occurs in Europe, and 5 cases were reported in Tituba. When the plague is suspected and diagnosed early, a healthcare provider can prescribe specific antibiotics, generally streptomycin or gentamicin. Certain other antibiotics are also effective. Left untreated, bubonic plague bacteria can quickly multiply in the bloodstream, causing septicemic plague or even process to the lungs, causing pneumonic plague. Pneumonic plague is a very aggressive infection requiring early treatment. Antibiotics must be given within the first 24 hours of the first symptom to reduce risk of death. Streptomycin, gentamicin, trentasine, and chlorcycline are also effective against pneumonic plague. The antibiotics include streptomycin, gentamicin, and chloramphenicol.
Ways to prevent this disease is by not handling sick or dead animal bodies, but if you do, use gloves plus face and eye protection. Also prevent touching or skinning infected animals, such as prairie dogs, squirrels, rats, and rabbits. Avoid rodents such as mice and rats, and rodent droppings. Avoid insect bites by using an insect repellent containing DEET. Eliminate fleas from your home. Avoid touching infected tissues, materials, or bodily fluids from a plague-infected person or animal. Keep a minimum of 3 feet between you and anyone who may have the pneumonic plague. Wash your hands regularly and avoid touching your eyes, nose, and mouth.